You've probably tried heating pads, herbal teas, and maybe more ibuprofen than you'd like to admit. But what if the most effective, doctor-approved relief strategies aren't the ones everyone talks about? For many, period pain can be more than an inconvenience. It can disrupt work, school, and daily activities. And if you've been following all the usual advice without much relief, you might be wondering, what am I missing? Today, you'll discover 5 doctor-approved strategies that can help you get ahead of the pain, instead of chasing it after it starts. One of these in particular is something most people never even think to try, yet it could make all the difference. When was the last time you prepared for your period before the pain began? Most people only act when symptoms appear. This is why the pain often feels harder to control. Secret 1. The preemptive strategy. Many wait until cramps are strong before taking pain relief. By then, the body's prostaglandin levels are already high, and the discomfort has fully set in. A proactive approach, taking NSAIDs like ibuprofen or naproxen sodium before severe pain starts, can help manage these levels from the beginning. This isn't about guessing. Track your cycle and start at the first sign. And later, I'll share a way to combine this with a natural method so you can get relief from 2 angles at once. Secret 2. The dynamic duo. Heat plus gentle movement. Heat relaxes uterine muscles and increases blood flow, while gentle movement releases endorphins, your body's natural pain blockers. Instead of doing one or the other, start with heat for 15-20 minutes, then follow with gentle stretching or yoga. The heat makes movement more comfortable, and the movement multiplies the relief. Do you remember a time when physical activity actually made your cramps better? Many realize only in hindsight that light activity can help because endorphins subtly reduce pain signals. Secret 3. The anti-cramp diet. Certain nutrients like magnesium and omega-3 SA may help relax muscles and reduce inflammation. Foods like leafy greens, nuts, and fatty fish can be beneficial when added consistently. Herbs like ginger and turmeric have also been studied for their potential role in easing discomfort. And wait until you hear the hydration method in Secret 4. It's something you can start today without changing your diet at all. Secret 4. The hydration upgrade. Hydration supports muscle function and reduces bloating-related discomfort. Warm water and herbal teas such as chamomile, peppermint, or ginger may further relax muscles and calm spasms. Begin increasing hydration a few days before your period and keep it consistent. If you had to pick one daily habit to keep cramps lower, what would it be? Many choose hydration because it's the simplest to maintain and supports all the other strategies. Secret 5. Know your normal. Tracking your cycle and symptoms gives you a baseline. If your discomfort regularly prevents daily activities, isn't relieved by over-the-counter options, or changes suddenly, it's worth discussing with a healthcare provider. Bringing detailed notes helps your provider recommend tailored options, whether lifestyle adjustments, devices like TENS units, or medical treatments. And this is why knowing your normal is the final secret. It helps you decide when home strategies are enough and when it's time for professional support. The real power comes from combining these strategies. 1. Preemptive NSAID use. 2. Heat plus movement. 3. Anti-cramp diet. 4. Hydration upgrade. 5. Knowing your normal. By being proactive, you shift from reacting to preventing. If you try just one new strategy this month, which one could change how you experience your cycle? The answer is personal, but the first step is simply trying one.